Have you ever found yourself kind of stuck in that cycle of chronic pain? And I don't just mean the ache itself, but, the worry about moving, that fear it might make things worse.
hmm Or maybe the thoughts that just spiral, taking every little sensation and blowing it up into something, well, catastrophic.
Exactly. It's this really common, incredibly draining thing so many people face, and it often leads to this constant search for something, anything that works.
Yeah.
So today on the deep dive, we're really getting into the whole complex world of chronic musculoskeletal pain.
But with a specific twist, right?
Right. We're zooming in on the psychological side of it, things like fear avoidance, kinesiophobia, and pain catastrophizing. And the big question we're tackling in this deep dive is, what impact does manual therapy actually have on these mental and emotional parts?
That's the core of it.
Our mission here is to unpack a really interesting study. It's a systematic review and meta-analysis called Effects of Manual Therapy on Fear Avoidance, Kinesiophobia, and Pain, Catastrophizing in Individuals with Chronic Musculoskeletal Pain. It was published in Musculoskeletal Science and Practice.
And the goal is to distill what the research found, the really important bits, and what it could potentially mean for you, the listener.
Yeah, absolutely. And first, it's worth just pausing on the scale of this. Chronic musculoskeletal pain isn't trivial.
Not at all. These conditions are actually the third most common cause of disability across the globe.
Wow, third.
Yeah. And when we talk chronic, meaning pain that sticks around for 3 months or more, estimates suggest it affects somewhere between like 11% and 24% of people generally.
That's a huge chunk of the population dealing with persistent pain.
It really is.
And like we hinted at, it's so much more than just the physical feeling, isn't it? It often brings along these psychological factors that can be just as tough to deal with. Can you maybe break those down for us?
Absolutely.
Yeah.
When pain goes chronic, the mind gets deeply involved. One big one is fear avoidance beliefs. This is basically being afraid of certain activities, physical stuff, work stuff, because you think it's going to cause pain or make existing pain worse.
Okay, so you start avoiding things.
Exactly. You avoid movements, tasks.
Yeah.
It creates this restrictive pattern out of fear.
Right.
Then you've got kinesiophobia. Now, this takes the fear up a notch. It's a more extreme, sometimes irrational fear of movement itself. It comes from feeling really vulnerable to getting injured or re-injured.
So like terrified to bend over or lift something.
Yeah, precisely. Because you're convinced it's going to cause harm. It's like your internal alarm system is just jammed on high.
Okay, that sounds intense.
And the third one is pain catastrophizing. This is more of a negative thinking pattern, an emotional response where you tend to exaggerate the pain, constantly dwell on it, or feel like it's the absolute worst it could possibly be.
That feeling where every little twinge becomes this huge, awful scenario in your mind. Hopelessness, maybe?
Yes, spiraling into hopelessness or feeling helpless about it, that's catastrophizing.
Wow, sounds incredibly draining, just dealing with those thoughts and fears on top of the pain itself. And I'm guessing these psychological bits, they don't just stay inside your head. They must impact life in real ways.
Oh, absolutely. They have very tangible effects. These factors often lead people to become much less physically active, which ironically can sometimes make the pain cycle even worse.
Right, the less you move.
Exactly. They can really chip away at your overall quality of life. They can actually increase how intense the pain feels, and they're strongly linked to higher levels of disability and even missing work.
It sounds like a classic vicious cycle. The fear and negativity feed the pain feeds the fear.
Precisely. Makes it really hard to break free.
Okay, let's unpack this, especially connecting it to manual therapy. A lot of us have heard of it, maybe even tried it for, a stiff neck or a sore back. But what exactly is manual therapy? What kind of techniques are we talking about?
Sure. So manual therapy is really an umbrella term for a bunch of different hands-on techniques. Practitioners use their hands to treat musculoskeletal issues. The source paper mentions several examples.
What?
Well, there's joint mobilization. Those are usually gentler movements to help restore motion in a stiff joint. Then you have soft tissue techniques, things like myofascial release, massage, focused pressure on muscles and the fascia around them.
Okay.
Also things like muscle energy techniques, hold relaxed stretching, ischemic compression. Yep. And then the one people might think of more readily, the high velocity, low amplitude thrust manipulations, or HVLA, those quick adjustments.
Right, the cracks or pops sometimes associated with chiropractic or osteopathy.
Exactly. So it's a pretty broad range of hands-on approaches.
Definitely more than just a basic massage then.
Sure.
And traditionally, I think when people hear manual therapy, they picture those physical effects, loosening a muscle, moving a joint. But you mentioned this idea of it potentially working psychologically, too. That feels like a pretty big shift. How does that top-down idea work?
It really is a shift, or maybe an evolution in thinking. Traditionally, yeah, the focus was on bottom-up mechanisms,
Meaning,
meaning effects that start at the tissue level and go up to the brain. So direct neurophysiological changes like pain modulation signals, biomechanical improvements, better joint movement, less stiffness, and, of course, the placebo effect, which is always a factor.
okay, that makes sense. Body affects brain.
Right. But more recently, these top-down models have gained traction. These suggest manual therapy might also work via pathways, starting in the brain and influencing the body and perception.
Interesting. Like what kinds of pathways?
Well, things like the patient's own expectations. What you believe will happen can genuinely influence the outcome. Another is graded exposure. The idea that experiencing safe, controlled movement or touch during therapy can help desensitize an overprotective nervous system.
Ah, okay. Teaching the brain that movement isn't dangerous.
Sort of, yeah. And maybe one of those powerful factors is the context surrounding the therapy, especially the therapeutic alliance, that relationship of trust and collaboration between you and your therapist. That can profoundly shape how you perceive the treatment and its effects.
So the big question the study tackled was basically, can these hands-on treatments actually change those deeper psychological patterns around pain, the fear, the catastrophizing, not just make your back feel looser, but change how you think and feel about the pain?
Exactly. That was the core question. Does it go beyond the physical?
Okay, here's where it gets really interesting then. We've got the chronic pain, the psychological shadows, the different ways manual therapy might work. Now, the moment of truth. What did this specific systematic review actually find about manual therapy, changing those fears and thought patterns? What kind of study was it?
Right. So this study by Kamonseki and colleagues is, as you said, a systematic review and meta-analysis. And just to quickly clarify for listeners, a systematic review is a highly structured way of gathering all the relevant research on a specific question.
Like a super study.
Kind of, yeah. It aims to be comprehensive. Then, a meta-analysis often follows, where they statistically combine the numerical results from those individual studies. This pooling gives you a potentially more precise estimate of the effect, like having a much larger sample size.
So they looked really thoroughly for studies.
They did. They searched major scientific databases right up to March 2020. They were specifically hunting for randomized controlled trials, or RCTs.
The gold standard.
Pretty much, yeah. RCTs comparing manual therapy against something else for people with chronic musculoskeletal pain. So, pain lasting over 3 months. And crucially, the studies had to have measured fear avoidance, kinesiophobia, or pain catastrophizing as outcomes.
Okay. And after all that searching and filtering, how many studies actually fit the bill?
In the end, they included 11 RCTs in their review and analysis, and those 11 studies involved a total of 717 people.
717. Okay, that gives them something substantial to work with when pooling the data.
It's a decent number for a meta-analysis in this field, yeah.
All right, let's cut to the chase. What did they find? First off, comparing manual therapy against doing nothing, no treatment, did it help with fear avoidance?
Okay, so for short-term effects, looking at outcomes up to about 3 months, the review found that manual therapy was not superior to no treatment for reducing fear avoidance.
Not superior. Interesting.
Yeah. Now, they did see what's called a moderate effect size, which suggests there might have been some difference observed. However, this difference wasn't statistically significant.
Meaning it could have just been due to chance.
Exactly. Given the data they had, they couldn't confidently rule out chance as the explanation for that moderate difference. And really importantly, this finding was based on low-quality evidence.
Okay, low quality. We'll come back to that. What about longer term, say, out to a year? Did it look any better then?
A similar story for the intermediate term, which they defined as 3 to 12 months. Again, manual therapy was not found to be superior to no treatment for fear avoidance. Moderate effect size, but still not statistically significant, and again, based on low-quality evidence.
Right. And it's worth digging into that difference you mentioned, effect size versus statistical significance. Can you clarify that a bit?
Sure. The effect size tells you about the magnitude or size of the difference they saw between the groups. A moderate effect size, like they found here, might mean the difference is large enough to be potentially meaningful for a patient what we call clinically relevant.
Okay, potentially noticeable.
Potentially, yes. But if it's not statistically significant, it means we can't be sure that difference is real. It might just be noise in the data, especially with smaller or lower quality studies. You'd need better, larger studies to see if that moderate effect holds up and becomes statistically significant before you could confidently say it's a real, reliable effect.
That's a crucial distinction. So for fear avoidance versus no treatment, the takeaway is maybe some hint of an effect, but the evidence is weak and we can't be sure it's real.
It's a fair summary based on this review, yes.
Yeah.
Especially keeping that low evidence quality in mind.
Okay. Now, what about comparing manual therapy to other active treatments? Did it perform any better there for fear avoidance or for kinesiophobia or pain catastrophizing?
So when they compared manual therapy against other treatments in the short term, the results were pretty consistent across the board. Manual therapy was generally not better.
Not better across all three.
Pretty much. For fear avoidance, the difference compared to other treatments was small, not statistically significant, and this was based on very low quality evidence.
Very low now.
Very low. And they did cite one specific study by Fursum and colleagues, which actually found that a different approach, cognitive functional therapy, was superior to manual therapy for fear avoidance.
Okay. And for kinesiophobia and catastrophizing versus other treatments?
Same pattern. For short-term kinesiophobia, manual therapy was not better. Small difference, not significant, very low quality evidence. And for short-term pain catastrophizing, again, not better than other treatments. Small difference, not significant, very low quality evidence.
Wow. So consistently not better and based on very low quality evidence for those comparisons.
Exactly. And that quality of evidence rating using the grade system is really the headline here. Consistently low or very low. What that means for you, the listener, is that our confidence in these results is really limited.
Right.
The true effect of manual therapy on these specific psychological factors could actually be substantially different from what these pooled results show. It's a massive caveat.
Okay, so if the confidence is so low, why? What were the main problems with the original studies that got pulled into this review? What led to those low or very low grade ratings?
Well, there were a few key issues flagged by the review authors. First, a lot of the studies just had small numbers of participants. The average was only about 65 people per study.
Which makes it hard to find real effects.
Exactly. Smaller samples have less statistical power, meaning they might miss a real effect, or an observed effect might just be due to chance. Second, there was what we call heterogeneity.
Meaning the studies were all quite different.
Yeah, they varied in terms of the specific population studied, the exact manual therapy techniques used, the comparison treatments, how outcomes were measured. This variability makes it harder to cleanly combine their results.
Makes sense.
And finally, because there were only 11 studies included in total, and even fewer for some specific comparisons, the researchers couldn't really assess something called publication bias.
Which is?
That's the potential tendency for studies that find positive or statistically significant results to get published more easily than studies that find no effect or negative effects. If that bias is present, a review might overestimate the true benefit because it's missing the negative unpublished studies. But with so few studies here, they couldn't really check for that.
Got it. So small studies, lots of variation, and uncertainty about missing pieces. That paints a clearer picture of why the confidence is low. Now, the review also mentioned combining treatments. What was the thinking there?
Yeah, this is a really important point. The review authors noted that other types of therapies, specifically behavioral and cognitive ones, like graded activity, exposure therapy, pain neuroscience education, cognitive behavioral therapy, CBT, do have evidence showing they can reduce pain-related fear.
Okay, so we know those things can work psychologically.
Right, but interestingly, only 2 of the 11 studies included in this review actually combined manual therapy with any of those psychological or behavioral approaches.
Only 2? Huh.
Yeah, so it raises a big question. If manual therapy alone doesn't seem to strongly impact these psychological factors, according to this review, but we know psychological approaches do, maybe the real benefit lies in combining them, addressing both the physical and the psychological together.
That seems logical, but the evidence isn't really there yet from this review to say for sure.
Exactly. It points towards a really important area for future research, looking at those combined approaches much more closely.
And what about the type of manual therapy? Did it matter if it was, say, a joint mobilization versus one of those HVLA thrusts?
They tried to look at that with subgroup analyses. They compared HVLA techniques versus non-HVLA techniques for fear avoidance and pain catastrophizing. They didn't find any definitive differences. The evidence was just too limited and varied within those subgroups to draw strong conclusions. So whether one type of manual therapy is better than another for these psychological outcomes, still an open question based on this review.
Okay. And there was another kind of surprising point about how these psychological factors were even measured in the studies, right?
Yes, this was quite striking. The review authors found that many studies they initially screened actually used measures of fear avoidance or kinesiophobia only at the start of the study, just to describe the participants.
Just as a baseline description.
Right, not as an outcome measure to see if the treatment actually changed those things over time.
Wow. So if you're not even measuring the change, you obviously can't know if the treatment caused a change.
Precisely. This lack of studies using these psychological factors as primary outcomes seriously limits the amount of direct evidence available to answer the review's core question.
That definitely complicates things. So putting this all together, what does this mean for you, the listener, maybe someone dealing with chronic pain and considering different options?
I think it means approaching manual therapy with a clear, nuanced perspective. It's widely used. It can provide physical benefits like pain relief for some people. However, based on this specific, comprehensive review,
The best evidence we have currently.
right, the current evidence does not strongly support the idea that manual therapy, when used alone, is superior to doing nothing or using other treatments for directly improving fear avoidance, kinesiophobia, or pain catastrophizing.
But with that big asterisk about the low quality of evidence.
Exactly. It's not saying manual therapy definitively doesn't help these factors for anyone. It's saying the research conducted so far doesn't provide strong, confident proof that it does,
Yeah.
especially compared to other approaches or no treatment.
Okay. That low confidence is key. So if the current answers are murky, what's the path forward? How do we get clearer answers?
Well, the strength of this review is that it pulls together everything up to 2020 on this specific question. It gives us the most up-to-date summary, but its main takeaway is really a call to action.
For more research.
Yes, definitely. We need more high-quality studies to strengthen the evidence and give us more confidence one way or the other. Specifically, more robust, randomized controlled trials.
And what would make these future studies robust?
They need solid methodology. Things like making sure treatment allocation is concealed so no one knows who's getting what beforehand. Having outcome assessors who are blinded, they don't know which treatment the participant received, to avoid bias in measurement. Using an intention to treat analysis, which includes everyone who started the study, even if they dropped out.
Okay, stricter methods.
Stricter methods and critically much larger sample sizes than we saw in most of the studies included here. Bigger samples give you more statistical power to detect real differences if they exist.
And what should they compare?
Ideally, future studies should compare manual therapy alone. Manual therapy combined with other approaches like exercise or cognitive behavioral therapies, and compare all of those against control groups like no treatment or standard care. That way, we can really understand the unique contribution of manual therapy, if any, and how it might work best alone or as part of a package.
This really raises an important question then. If the current evidence, weak as it is, suggests manual therapy alone doesn't strongly move the needle on these psychological factors, how should we be thinking about managing chronic pain more effectively? Does the focus need to shift?
That's a powerful thought to end on, isn't it? It pushes us to think beyond just the physical symptoms.
So just to recap quickly, manual therapy is common for chronic musculoskeletal pain. This major review looks specifically at its effects on fear avoidance, kinesiophobia, and pain catastrophizing.
And the conclusion, based mostly on low or very low quality evidence, was that manual therapy wasn't shown to be superior to no treatment or other interventions for these psychological outcomes.
Right. Which leaves us with this provocative thought for you to consider. Given how much we know psychological factors influence chronic pain, how might we need to evolve treatment? Could a truly integrated approach, blending physical therapies with solid psychological support, be the key to better recovery and well-being?
And what role do your own individual beliefs and expectations play in how well any therapy works, even one like manual therapy, where the direct psychological effects are still under investigation?
Lots to think about there. Thanks for diving deep with us today.